Surgery for breast cancer actually involves more than just surgery on the breast, but it involves surgery for the breast tumor in the breast, the lymph nodes, and reconstruction of your breast as well. The types of breast cancer surgery are pretty much divided into the types of surgery we do on the breast to remove the tumor, the types of surgery we do in the axilla or the armpit to stage the lymph nodes, and then the surgeries that the plastic surgeons will do to recreate or reshape the breast. So I'll start with the first one, which is the surgery that we do to remove the tumor. And that's pretty much divided into lumpectomy or mastectomy. A lumpectomy is also termed a segmental mastectomy because it removes a segment of the breast, and it's just removing the tumor itself and a rim of normal tissue around it to get clear margins. The other one is called a mastectomy, which removes the entire breast. And nowadays, we can do this by removing all of the breast tissue and the skin overlying it. We can do it by just removing the breast tissue under the skin, called a skin-sparing mastectomy, and that leaves a skin envelope for the reconstructive surgeon to rebuild a new breast under it. And then the last type is called a nipple-sparing mastectomy, which saves the nipple and the skin pocket, and then it allows the plastic surgeon to recreate that breast under it as well. Now, the types of surgery that we do for the axilla or the armpit are generally lymph node type surgeries, and those would be divided into what we call a sentinel lymph node biopsy or an axillary lymph node dissection. Nowadays, if you don't start with lymph nodes that you can already feel or are suspicious in the armpit, most surgeons will start with what we call a sentinel lymph node biopsy. In that procedure, a dye or a radiotracer is injected into the breast tissue at the time that you're asleep, and the surgeon will follow that dye up to the armpit and find the sentinel node. The sentinel node is what we call the first node in the chain of lymph nodes that leads up and drains your breast into your armpit. And by identifying that sentinel node, we're able to see if any tumor cells have escaped the breast into your armpit. And it gives us a good sense of whether tumor cells have gone any further than that as well. Now, sometimes if the sentinel node comes back positive on the final pathology, or if you start off and your surgeon already suspects that you have tumor cells in your lymph nodes in your armpit, they will proceed to what we call an axillary lymph node dissection. And that removes all the lymph nodes in what we call level 1 and level 2 of your armpit. So you actually have 3 levels of lymph nodes in your armpits. And I wouldn't worry that your surgeon is taking all of your lymph nodes out and you won't have anywhere for your lymph to drain, because you actually have lymph nodes all over your body. You still have lymph nodes in that area that will do the job. But in general, it removes 2 levels of lymph nodes in your armpit. So that takes care of breast surgery on the breast surgery in the armpit or axilla, and then we come to the final type of breast cancer surgery, which is the reconstruction or recreation of the breast after a mastectomy. That's generally taken care of by the reconstructive surgeon or your plastic surgeon, and that I would divide into 2 main types. Types that use a foreign body called an implant, or autologous tissue, which is your own body's tissue to recreate and reshape the breast. And what type of reconstruction is chosen for you together with you is going to be based kind of on your body, based on your breast size, based on your medical history, and all of those things will be considered with you and your plastic surgeon too.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.